Can the perfect penis be too large? Let's settle this once and for all. I'm Dr. Ava Carter, and as a urologist, I get asked constantly whether bigger is actually better. Today, I'm giving you the research-backed answer because the truth might surprise you. Let's start with the numbers. When we study penile size in a clinical setting, we use something called stretched penile length, measured from the pubic bone to the tip. Across large population studies, the average erect length comes out to around 5 to 5.25 inches. That's it. That's average. And I know some of you just felt a wave of anxiety reading that. Don't. Because studies consistently show that the majority of men overestimate what normal actually looks like, largely because their only reference point is pornography, where performers are selected specifically for above average size, and camera angles do the rest. Comparing yourself to a porn star is like comparing your height to an NBA lineup. It's not a representative sample. Now here's where it gets interesting, because the question isn't really what's average, it's can too much of a good thing become a bad thing? And the answer, according to research, is yes. The vaginal canal at rest is only about 3 to 3.5 inches deep. During arousal, it undergoes something called vaginal tenting, where the inner portion expands to roughly double that depth to accommodate penetration. So on average, an average penis and an average vagina are built to fit each other well. That's not a coincidence. That's anatomy doing its job. But when length exceeds what tenting can accommodate, the tip can make contact with the cervix. And while a small number of people enjoy that sensation, for most women, cervical contact causes discomfort or outright pain, not pleasure. Girth tells a similar story. There's actual research on this stemming from an unexpected source. Surgeons creating neovaginas and neophalluses for transgender patients ran into a real problem. When they built these anatomically larger than average, partners often couldn't comfortably have penetrative sex with them at all. So researchers went back and studied what sizes women actually gravitate toward when given free choice, like the dimensions of sex toys purchased on the open market. And guess what? The preferences clustered right around average, not the exaggerated end of the spectrum, average. So if you're on the larger end, does that mean you're guaranteed better sex? Actually, it can backfire because when someone assumes their size does the heavy lifting, they often stop investing in technique. Foreplay gets skipped, communication gets skipped, and here's the part that really matters. The most reliable route to orgasm for most women is clitoral stimulation, which has nothing to do with penile length or girth. Nothing. So a bigger organ without better technique isn't actually solving anything. Sometimes it's creating a new problem while ignoring the real one. And on the flip side, being consumed with anxiety about your own size, whether you think you're too small or worried you might be too big, pulls you completely out of the moment. Instead of being present with your partner, you're mentally narrating your own performance. That cognitive load kills intimacy. It kills pleasure for both people. So what actually predicts great sex? Not inches. Communication. A meta-analysis covering 93 studies and nearly 40,000 people in committed relationships found that it's then sexual communication, meaning how openly and specifically partners talk about what feels good, was the strongest predictor of both sexual satisfaction and relationship satisfaction. And yet, even in long-term relationships, partners correctly guess what the other person actually enjoys only about 62% of the time. That means over a third of what your partner wants, you're just guessing at. Nobody taught us how to talk about sex, but that conversation matters more than any measurement ever will. So here's what I want you to actually do. Explore your own body and encourage your partner to explore theirs. Talk openly, even if it starts small and awkward, because it gets easier every time you do it. And if size anxiety is genuinely affecting your confidence, your intimacy, or your self-worth, talk to a therapist or a sexual health professional. That distress is real and it's treatable. Because at the end of the day, size isn't the variable that determines good sex. Skill, presence, and communication are. And those, unlike anatomy, are things you can actually work on.